Wow.
Surgery that I find like, wow, this is my thing. I became my own work of art.
Those are some very large breasts. Ooh. Quite the waist trainer on her. So she's definitely shifted in her internal organs, actually, to have a waist that small.
To achieve is a very
Plastic and proud.
Well,
Well, I definitely don't have anything against plastic surgery. Clearly, I'm a cosmetic surgeon, and I'm happy to help people achieve their ideal figures. My aesthetic is a little bit more natural, though. I don't do any, really large fat transfers. I like more of that natural shape to my patients. So this is probably a little bit, something that I wouldn't do, but to each their own.
Augmentations for nose jobs, ears made like elf ears, few rounds of liposuction, one labioplasty, one plastic procedure, 6 ribs removed.
What?
I can't believe that just happened.
Ribs removed too. You have to be really, really unhappy to get your ribs removed and find a doctor that would be willing to do it.
I call it change to eyelid surgeries permanently. For Pixie, the list of her procedures goes on and on. I cannot really count how many procedures I had, but I would say it's...
This kind of patient comes to my office, I'm probably not going to do surgery on them. I prefer a more natural look, and she just had a lot of work done, so I don't think she'd be too happy.
Halfway up your back. Never seen one move.
Wow.
We've seen them flip. We've seen them go into the hips. We've seen them go too far down, but never really seen that. Huh.
Yeah, that's an implant that is completely in the wrong place. This is why I prefer using fat for any augmentation, especially in the buttocks. Also in the breast, fat just works really well.
Droopiness by doing a gluteal lift halfway up your back.
Yeah, so she, unfortunately, with any implant, they can definitely move out of where you originally put them. With fat, if you're putting them, in that superficial layer and following all those post-op care instructions, it's going to stay where you put it. If you stay at a stable weight, it's going to look that way indefinitely, So this poor patient, that's unfortunate this happened to her, but this is a pretty well-reported complication that could happen anytime that you get implants.
Before my surgery, my friends called my butt the dum-dum because it looked like an uneven pair of giant basketballs.
Yes, these are very uneven buttocks. Unfortunately, that's very unlikely to happen with fat. Fat is just going to look more natural. It's like nice and soft, and in that area, it heals really well.
Body implants that were causing me a lot of pain. I had a dent in my lower left butt cheek. My quality of life had just been taken from me. But now, thanks to Dr. DeBro, I have a naturally projecting butt that is symmetrical.
Yeah, so in order to fix this, they definitely had to remove those implants and then use some of her own fat to reshape those contours of the buttocks. Even for patients that don't have a lot of fat on their body, there are options where you can fill in any holes or any deficits with filler. So that's another option that we do at our clinic if you're very thin.